The missing piece, why your x-rays need a dynamic upgrade. In this video, watch the epic clash between DMX and static x-ray views. We love x-ray. We've used x-ray for a long time. I'm standing here in our x-ray suite. We have a very elaborate x-ray suite. We get a ton of information off of static x-ray. But static x-ray is just that. It's standing still, it's not moving. And there's a whole different host of information that we get off of a digital motion x-ray or a movement x-ray. So we're walking over into our DMX suite or digital motion x-ray unit, which is right here. Main differences between digital motion x-ray and static x-ray, there are several. Static x-ray primarily is something that we use to figure out, is there a pathology? Like, is there some sort of tumor or something going on with the bone or the tissue that we're gonna see on that x-ray? Is there a fracture? Is there a dislocation? Is there a reason that we should not be working on the patient? And then from a chiropractic standpoint, once we find the problem on the patient, the x-ray tells us how to best fix it. We can measure alignment, we can look at curves, we can get an idea of the best way to adjust, the best way to do specific corrective exercises, rehab, that sort of thing. X-ray is incredibly valuable for that. The thing that x-ray does not tell us, that DMX tells us, is how well a joint is moving and if a joint is moving excessively, meaning if there's too much movement, that's called instability. That means that there's ligament damage in that area. If a joint is stuck and restricted and not moving, that gives us as a chiropractor a ton of information as far as what areas we should be focusing on, as far as adjusting various exercise, traction, rehabilitation measures, that sort of thing. So digital motion x-ray is a game changer in specificity, in precision, in getting us to target our care based on this valuable information that up until recently at this clinic here in Meridian, Idaho, we didn't used to have digital motion x-ray. We worked off of plain film x-ray, and we have a very elaborate and high-tech unit to do that so we can get crystal clear imaging. But now, fortunately, we can do the same thing in a motion version of that as well. So we're really excited to have both of these types of techs. They both show us different info. A lot of our patients benefit from actually getting both of these studies done depending on what's going on with them. But there's a massive difference between digital motion x-ray and plain film x-ray. I hope this helps explain some of the differences between these two types of imaging studies. So if you've suffered a neck injury, you need to schedule a consultation with us. Click the button below and find out if you have a hidden spinal ligament injury.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.